So in the visual pathway, if I talk about the applied aspect, the loss of vision in one visual field is known as anopia, and the loss of vision in one half of the visual field is called as hemianopia. Now, hemianopia is classified into two types, homonymous and heteronymous. Now, homonymous means that the loss of the vision is in the same half of both the visual field. Means that if there is a right, same half means both the nasal field or both the temporal field is lost of both the eyes. Same half, matlab either the nasal half or the temporal half. Heteronymous means the loss of the vision in the opposite half. For example, binasal heteronymous hemianopia means the nasal half of the both the visual field. So this will be more clear if we'll see the diagram. So the loss of vision in the same half means that the nasal, the temporal half of both the visual field, this is the hemianopia. And hetero means the loss of the vision in the right half, the loss of the vision in the right half of the left visual field. Left visual field का जो right half है, that means the temporal part, and the left half of the right visual field. So that is the heteronymous hemianopia is also classified into bitemporal and binasal. Now coming to this diagram, if there is this temporal field and there is this nasal field, so if there is complete loss of the vision in one eye, that is in the A example, that is known as the anopia. Now the hemianopia, we have heteronymous and we have homonymous. The heteronymous is the B example, heteronymous hemianopia. What is happening in the B example is there is in the A portion there is a lesion in the optic nerve of the left eye. That is why the complete eye, the left eye is completely damaged, the loss of the vision in the left eye. Coming to the B example, there is a lesion in the optic chiasma. Now what is happening? The temporal part is coming to the ipsilateral, it is not crossing, but the nasal portion is crossing to the contralateral side. So whenever there is a lesion which is present at the optic chiasma, which is the B lesion, so what is happening? If there is a loss in, so there is the temporal nerve is actually not affected by this lesion. The nasal nerve is affected by this lesion. The nasal half is affected by the lesion. Now this nasal half receives the information from the temporal field. So both the nasal half receives the information from the temporal field. So here in the B example we can see that in both the eyes, in the left and the right eye, the temporal part of the visual field is lost. That is why it is an example of hemianopia. but it's an example of heteronymous because in the left eye there is the same area is not affected, the different areas are affected. Now coming on to this third example, the C example, which is the heteronymous hemianopia. The third example is the homonymous hemianopia. So in the homonymous hemianopia there is a lesion in the optic tract. Now here this the temporal is coming from the left eye and the nasal is coming from the right eye. So what is happening, there is the temporal was receiving the temporal portion was the receiving from the nasal half of the visual field. So here the nasal half is lost of the left eye, and this was coming from the right eye. This nasal portion is coming from the right eye, and this was receiving from the temporal part, and so henceforth in the right eye the temporal part is lost. So in the left eye the right part is lost, and in the right eye again the right part is lost. Fine, that is why it is known as homonymous. The same side of the visual field is lost. That is why it is known as the homonymous hemianopia. And the fourth one is the macular sparing. Now macular sparing always happens whenever there is a lesion present just after the lateral geniculate body in the optic radiations. The optic radiation which was coming from the LG body. So the loss of peripheral vision with the normal and the complete macular vision. Macular representation in the occipital lobe is separate. That is why this will preserve the vision in the center of the visual field. The center of the visual field is also known as macula lutea. So here the presentation is like this because it will preserve the vision in the center of the visual field, because the macular representation in the occipital lobe is separated. So there is a normal loss of the peripheral, there is complete loss of the peripheral vision with normal and complete macular vision. Macular vision is the center vision is preserved. The vision in the center is preserved. It is only the damage to only the one hemisphere of the visual cortex. Central visual field is preserved after large hemispheric lesions. Is that macular regions of the cortex, they have double vascular supply. The main reason is the macular region have double vascular supply. So if one damage, there is another blood supply that the macular portion can rely on. That's why the macular sparing. The word is because the macula is spared. So it is present in the region just of the LG body. Now there is another term known as pie in the sky and pie on the floor. Now the pie in the sky means that there is a loss of vision in the superior quadrant. There is loss of vision because there is always a superior quadrant and an inferior quadrant also. So that is known as quadrant anopia. So the term known as the pie in the sky, which means loss of vision in the superior quadrant, and pie on the floor means loss of vision in the lower quadrant of the visual field of both the eyes. So these are some novel terms. There's another example we can see of the right homonymous hemianopia and left homonymous hemianopia. The loss of the vision in the right side of both the retina, that is in the left side of both the visual field, that is left homonymous hemianopia. So loss of vision if we talk about the left homonymous hemianopia, there is loss of vision in the right side. There is loss of vision in the right side of both the retina, that is in the left side of both the visual field. In the left-sided lesion, loss of the vision in the left half of the retina of both the eyes, and loss of sight on the right half of both the visual field. See, as you can see, the homonymous hemianopia, the right and the left. In the right, what is seen, the homonymous hemianopia, this is the left eye and this is the right eye. In the left eye, the right portion is destroyed. In the right eye, the right portion is destroyed. Then here, in the left eye, the left portion is destroyed, and in the right eye, the left portion is destroyed. That is why it is known as homonymous hemianopia. And over here, heteronymous, because in the left eye, the left portion is destroyed, and in the right eye, the right portion is destroyed. That is why it is known as heteronymous hemianopia. And both the temporal part is lost, over here also and over here also. The temporal part is loss of vision in the temporal part. Here also the loss of vision is in the nasal part. That is what is known as binasal heteronymous hemianopia, and that is what is known as bitemporal. यहाँ पे right homonymous, because the right portion is lost, right portion of the visual field is lost. अब if you can see, ये portion, this is the, over here it is the nasal portion, यहाँ पे this is the temporal portion. Now this nasal portion will receive the temporal part of the visual field, and this temporal field will receive the nasal part of the right visual field. So that is why this is known as right homonymous hemianopia. And as you can see over here left, because the left portion is lost, so this is the temporal, over here it is nasal. What you can do to remember this defects easily is just first draw this diagram. Try to first understand this portion, what is the meaning, how do they convey the messages, the temporal half and the nasal half, and then go to the defects. It's very easy to understand. And there is one test known as confrontation test. In confrontation test, please see it online. That's a very important test to check the accuracy, to check for the diagnosis of the peripheral vision. A confrontation test, and there is also an equipment known as perimetry बोलते हैं उसको. So please, perimetry is done in very big institutes, but you should be knowing about confrontation test. Please go and check what do you mean by confrontation test. It is used to check the peripheral vision of a person who is complaining of the loss of the defect, who's complaining of the loss of the vision in any of its areas of the field, be it superior, be it inferior, be it nasal, or be it temporal.